While Nigeria's healthcare systems may remain underdeveloped, it boasts a wealth of natural resources that have the potential to revolutionize its healthcare landscape. Consequently, it is essential for Nigeria to leverage its potential and available resources, including traditional medicine, to achieve favorable health outcomes and align with the United Nations Sustainable Development Goal, SDG 3, which centers on good health and well-being. For centuries, traditional medicine has served as the affordable and accessible healthcare option for the majority of Nigeria's population. Even today, particularly in rural communities, traditional medicine remains the primary source for fulfilling basic health needs for a significant portion of the country's populace. However, with the majority of practitioners lacking formal education and with inadequate government regulations, the sector has been left disorganized, and herbal medicine lacks clinical evidence to justify its use. Aliyu Ibrahim, a traditional medicine practitioner in Maraba who barely communicates in English, told Rootstv that he learned the skill from his father.
That is this one, and typhoid malaria. Typhoid and malaria. But this one come, see.
Okay, now Hindi.
See.
Typhoid and malaria.
Typhoid and malaria for this one come.
How did they take them?
So typhoid and malaria, I don't take my inside body. This one I go taking 7 days. One bottle in the morning, one bottle in the evening. One bottle in the morning, one bottle in the evening. So everybody don't take way. No be buy water on. You carry powder on. Go join on this one. May I go cook them. Take it in the morning, in the afternoon, in the night. Wash them all of day. Typhoid and malaria go throw away.
So which other one you would like to tell us about? Like this one waiting your side. Wait till they do.
This one. But this one come. That back pain, waist pain, rheumatism. Go catch my body. Go sit down here. No. Wait. If you buy this one, you go cook them. Carry jankanwa. They hear jankanwa ba? Go cook them. Take it in the morning, take it in the afternoon, take it in the night. That rheumatism, they catch my body. Wait. Go take in 10 days. Go kill them. All of them go kill them. Throw away. No forge.
Alhaji Dr. Shaba Maikudi, President of the National Association of Nigeria Traditional Medicine Practitioners, believes that strengthening the traditional medicine in Nigeria's health systems can also improve access to quality health care, vital for universal health coverage.
So why can't we go to our indigenous medicine? Why can't you at least remain so that we promote? We should take example, China and India today. See where they started from somewhere. See where they are today. They are the highest. So it is a time now for us to come so that we have the support of the government, and that is why we are trying to fight. We, the N90 MP, are trying to at least to tell the government to establish Traditional Medicine Council of Nigeria, which now has gone first and second reading. Even it has been passed now. It's before this, the president, the commander of Armed Forces of the Republic of Nigeria, to sign the law. I think if this law is signed properly, the practice will be regulated. The practice, and if the practice is regulated, I think we have no much problem, because especially what is our fear of the courts will be flushed out, because there is an existing law that will not allow you to do what is not right. So I think we need to government support. We need people should invest in traditional medicine so that we can be able to meet up an international standard. I think these are the issues area we're supposed to.
Nevertheless, traditional medicine persists despite the dominance of Western medicine. Natural remedies gain popularity globally, with roots in China and India. Nigeria's traditional medicine could tap into a global market with the right support, improving health and fostering economic growth. However, formal healthcare systems in Nigeria often lack support for traditional medicine, hindering its acceptance, with a considerable number of herbal practitioners struggling to convince the public to buy their products.
Somebody where they suffer from arthritis, rheumatism, 9 days, instead of consuming painkillers, see what you go carry treat yourself. All of una waste sabi this plant, abi chairman, you know am. Stubborn plants, very difficult to uproot, very difficult to cut. Botanically, they call them cedar akuta, 9 days. Please, you that is having this accumulation of uric acid, where they tamper with your ligaments, they cause you waist pain, they cause you arthritis, use them. How to use it, please, very, very important. Go where the plant they grow. Try to harvest this thing for me with the roots. Come house. I beg, don't cut the root off, because the medicinal component of this plant is highly concentrated on the roots. Get out with the root, come your house. Are we together, please? After bringing it, I beg, get me a knife. Cut, please, you can write it or you can record it. Carry knife, cut this thing small, into chips. Everything where you cut, carry go put for pot. Are we together, please? Any pot that can contain 5 liters of water and above, carry 5 liters of water, add them inside the medicine, weigh the inside pot. If you cannot cut this thing because it's very stubborn, as a correct African person, what do you do? Fold. Now to fold them and be put for the pot. Are we together? Carry water, add them. Carry that pot, go put for fire, allow the medicine to boil for 30 minutes. How many minutes? 30. Please, the 30 minutes so they talk, begin time watch. Now when medicine start to boil, no be as you put for fire. That is, you start timing from the boiling point. After 30 minutes, you don't bring them down. Are we together? Look for sift and remove these chaffs away. If you leave the chaffs in the pot, the medicine no go past 2 days. You go begin smell, fermentation will go, you might not be able to use it again. Are we together? From all the chaff, may you throw away. The medicine and the water will remain inside the pot. Now that water they treat waist pain.
The World Health Organization, WHO, has reiterated the importance of integrating traditional medicine into national health systems in a safe and effective manner, guided by scientific evidence. WHO supports countries seeking to adopt traditional medicine practices, ensuring they do so in a science-based way to prevent patient harm and guarantee safe, effective, and high-quality health care. Traditional medicines may have long-standing use and originate from natural sources. Rigorous clinical trials are essential to establish their efficacy and safety.
If well packaged, is accessible, affordable, and cheap. So for us now, it is for us now to go back to our indigenous medicine. Even the WHO, the World Health Organization, said it, that 95% of the world population today depend on natural medicine, that is traditional medicine.
You said how governments can be able to come together to even see how we can make use of these things. We've been trying to make some collaboration with the government for a while now. You can see we are even in front of the Ministry of Health. We've been here for a while. Ministry of Health has a department, herbal department. We've been trying to collaborate with them so how we can work together with them, because these things have no side effect whatsoever. They are just like your normal vegetables you eat. Because I see a lot of people complaining about side effects of using some of these plants. You know, gone are the days where you can be able to talk about side effect of natural plants. So I'll be talking about the liver. These days we've had consistent measurements that we can actually give to you if you are using these plants. So researches have been carried out over the years. You can see countries like China, you can see countries like India, even Madagascar, they've been able to improve on their natural medicine.
In an interview with pharmacist Titus Tille, director of the Traditional Complementary and Alternative Medicine Department at the Federal Ministry of Health, it was agreed that traditional medicine sector is still underdeveloped. He, however, mentioned significant efforts by the government to create a council that will be backed by law to regulate the activities of the practitioners.
You know, the best benefits of all of these healthcare systems. Of course, the whole world is talking about universal health coverage. Without these health systems, that is traditional medicine, complementary and alternative medicine, being utilized to the optimum, you can't even think of universal health coverage. Why do I say so? Because the practitioners are in every unit, every remote area of this country, you have practitioners. So if you are talking about universal health coverage, these are the two systems that you must develop. Without developing them, you can't be talking on universal health coverage. How many orthodox clinics do you have in the villages?
Very few.
Every nook and cranny of Nigeria. Very few. But this is an area that we have practitioners all over the country. They are not going to Japa as what is happening now. They are in the community. They are well respected, and they have nowhere to go than to be there and to serve the people. And so one other area is that we are looking at those practitioners. Ministry have been training them. Yeah, right. As far back as 2006, ministers have been. It's a continuous process, not on their practice, because their practice is them that knows it. But we engage them on areas that will make them to improve on what they are doing. You know, for example, they are operate in very unhygienic conditions